Hello, I'm Dr. Gerald Chodak. In previous videos, I've talked about the methods for grading and staging the prostate cancer. Now it's getting closer to decide what are you going to do. And to do that, you need to have some idea in the end of whether your cancer is located inside the prostate, is it growing through the wall, what are the odds that it's going to be in the lymph nodes. Fortunately, we have tools available that can give us a good estimate of the likelihood of where your cancer is located. This information has come out of Johns Hopkins University, where they've operated on a large number of men, and they've looked at where the cancer was located based on three things: the PSA, the Gleason score on the biopsy, and the tumor stage on the physical examination. Those three things have been combined, and in your pop-up window on the screen, you'll see references made to that paper and some of the information that you can gather by looking at the paper that's available over the internet. What this tells us is the following. We can give you an estimate of whether the cancer is completely inside the capsule, whether it's growing through the wall, whether it's growing into the seminal vesicles, and whether it's present in the lymph nodes. Those four pieces of information can be estimated by combining these three things together: the PSA, the Gleason score, and the tumor stage. And so you can look up the information that's appropriate for your case. In today's world, we actually are beginning to divide patients into three groups: low risk, intermediate risk, and high risk. Low risk patients have a very low risk that the cancer is outside the prostate, a low risk that the cancer is going to spread. The high risk men have a very high chance that it's outside the prostate and a high chance that that cancer is going to become very aggressive. And then intermediate falls in between. So for example, let's say that you're in the most common group of men diagnosed today. Those men have a PSA under 10. They have a tumor stage that's either T1 or T2. And they have a Gleason score of 6. About 70% of all men diagnosed in the United States today fall into this category. And fortunately, we can tell them the chance that the cancer is in the lymph nodes, 0 to 1%. This comes off of these tables. The chance that it's in the seminal vesicles is only a few percent higher than that. Most of the men will have cancer completely confined in the prostate, and a portion of them will have the cancer growing outside the capsule wall into the surrounding tissue. And so this information is the best way to get a good idea of where your cancer is located, and that information is, in my mind, the best way to help plan your course of action. What treatments should you consider? And those will be discussed more extensively in another video. The bottom line, those three things are the most important pieces of information. All the other testing that can be done doesn't provide much better or more useful information than simply combining the Gleason score, the tumor stage, and the PSA. So with that, in a future video, we're going to talk about how to combine that, how to use that information to planning your course of therapy. Thank you.